this meeting to order. So welcome everyone to meeting number 32 of the House of Commons Standing Committee on Health. The committee is meeting today to study the emergency situation facing Canadians in light of the COVID-19 pandemic. Specifically today, examining collateral effects of the pandemic. I would like to welcome our witnesses. Avec l'Association des chirurgiens cardiovasculaires et thoraciques du Québec,
we have Dr. Louis Perrault, President of the Association of Cardiovascular and Thoracic Surgeons of Quebec.
Braithwaite, Chief Executive Officer. With Huntington Hills Community Association, we have Rick Lundy, General Manager. With Success, we have Queenie Chu, Chief Executive Officer. And we will now invite the witnesses to give their statement.
First of all, we will be listening to Dr. Perrault. Go ahead, you have 6 minutes, sir.
Doesn't matter.
La langue de votre choix, parlez français.
The language of your choice. You could speak French. I can also speak in English.
So thank you for having me on in this meeting. As Mr. Davis said, I'm president of the Quebec Association of Cardiac Surgeons, been there for 3 years and been a practicing surgeon at the Montreal Heart Institute the last 25 years. This is not going to last 6 minutes, but obviously I'll be open to questions. So having a quarter century perspective on the health system, obviously I can see, I can diagnose acutely what happened during the pandemic, especially with non-COVID patients with cardiovascular disease. What we saw in the beginning was that there was a lot of room made in case the hospital system would be overloaded. And for many weeks and months, patients were not operated at the normal rate. Emergencies were basically the only kind of operations that we did. And this had a consequence on our waiting list. Most of the hospitals in the province of Quebec have waiting lists, and we tried to have a percentage of patients that are outside of acceptable delays lower than 10%. This is a calculation based on safety. If this is greater than 10%, then we're taking chances because it's very hard to predict what's going to go on with cardiovascular disease. So during the pandemic, even though we weren't at 10% before, we were most likely around 20%. This percentage of patients outside of acceptable delays for surgery rose to 40 and sometimes 45%. This is basically playing Russian roulette because it's very hard. You know, oncology is important, but in cardiovascular disease, we're fighting against sudden death, and sometimes it's very hard to predict how the course of the disease is going to go. So this is one of the points that I've made, a very large increase in the number of patients outside of acceptable delays. The second thing is patients not having access to cardiovascular care meant that some of them waited at home and showed up at the hospital in an unstable situation. So in a worse position that they would normally be. And what happens during those cases is that they obviously have more complications. They stay longer in the hospital. That is, if they survive. And this brings about a greater resource utilization and less room for other patients, including COVID patients in the ICUs, et cetera, et cetera. The third consequence is that, again, patients not having access to diagnostic procedures, they show up at a later stage. They have more severe disease, and obviously the chances of recuperation and, for example, going back to work is lessened because, let's say, normally they would have come in with a mild heart attack, but if they come in with a more severe one, they lose function and they become heart failure patients, and they become a burden, for our system, which would not have happened if they were treated promptly with the right timing. And again, having some of the problems that we're raising now on the long-term consequences of the pandemic are chronic problems that are related to underfunding, at least in the cardiovascular area or arena. And definitely, there's going to be a backlog of operations, and I'm thinking heart surgery, but also cardiology. These are the same patients, and I believe that we have to react urgently and consider long-term investments because some of the problems that we are facing right now have been going on for 20 years or more, and they've never been addressed properly. Any questions?
Thank you, Doctor. We'll go for our next witness statement then. With Blue Door Support Services, Mr. Braithwaite, please go ahead. 6 minutes, please.
Thank you very much for the opportunity to speak with you today. My name is Michael Braithwaite, and I'm the CEO of Blue Door. And Blue Door is an agency that's been working for close to 40 years to take care of our most vulnerable through housing, health, and employment initiatives in York Region. So when COVID-19 hit our sector, in order to stay safe, we had to lower capacity, which meant we were serving fewer people in need. And while the pandemic has hit everyone really hard, it's been especially hard on our region's most vulnerable. And we knew we had to respond. In talking with some of the seniors we support, the families, they were afraid for their health and wellness and unsure of the future, and many of them still are. With the help of provincial and federal funding that our region received, we were so fortunate to work with extremely talented and hardworking team in our region, as well as our amazing community partners, one of which, 360 Kids, and Clovis you'll hear from today, to quickly build solutions to quickly house and support those in need. So we had to move fast. One example of that actually was we were able to repurpose a vacant Parks Canada home that had been vacant for a number of years. Shortly will house 2 families with long-term affordable and supportive housing. And again, past the pandemic and into the future. As well, we were able to repurpose spaces at our current emergency housing space to regain capacity and add new supportive housing for senior men. And so there was a lot to celebrate in our sector and moving forward, but there's still much work ahead. As people use up the last of their savings, a lot of people are still hanging on. They're going to have to make a choice between food and housing, a choice that no Canadian should ever have to make. We need to work hard and invest in preventing people from experiencing homeless with investments in income supports and building new and deeply affordable housing with supports. I say deeply affordable. The definition of affordable right now is 80% of market, and that's far too high for many people experiencing homelessness. And we must make sure that our most vulnerable have easy and quick access to healthcare, an important part in helping people experiencing homelessness to acquire and retain housing. Lastly, we must push forward on the need for a housing strategy for Canada's urban, rural, and northern Indigenous people, something that was missing from our most recent budget. We have seen during the pandemic how quickly our sector can move if provided with the right supports in a timely manner. We saw that when thousands of people were housed really, really quick, and normally what would take us years and years, but we did it quickly in acquiring hotels, and being innovative, working together to make sure people had housing. We urge the government not to lose this momentum and to keep building on it moving forward. And we're grateful to the federal government for its continued support and for its pledge to end homelessness by 2030. They've shown us political will and has provided us with the resources to keep our most vulnerable safe for the long term. And on behalf of Blue Door, our region, our country, we're truly grateful. We're excited about the possibilities for the new and affordable housing as we move towards a country where everyone has a safe place to call home, and everyone should. Thank you.
Thank you, Mr. Braithwaite. We go now to Huntington Hills Community Association. Mr. Lundy, General Manager, please go ahead, sir. 6 minutes.
Yes, thank you very much for having me today. I'm actually here representing 4 different organizations, and one is I'm the general manager at Huntington Hills Community Association. I'm president and founder of Minds Over Matter Mental Health Society. I am founder of Open Arms Patient Advocacy Society, and I'm the president of Mothers Against Drunk Driving in Calgary. So the first area I'd like to talk about is in the community, and that's with Huntington Hills. We at Huntington Hills are an outlet for many human service areas. We were up until recently. So we had a lone parent, a parent link, and North Central Resource Center for all of the north of Calgary. In these programs, we help families, first of all, single parents find the resources that they need, parents to get the tools and have the tools and go through programs to be the best parent they possibly can, and for homelessness and low-income individuals in Northwest Calgary to help them get the resources that they need to for the basics of life. We also have a out-of-school care program here, so we deal with a lot of the little ones in society as well. Our mental health organization is called Minds Over Matter Mental Health. We deal with seniors, cultural groups, businesses and organizations, and children and youth. Mothers Against Drunk Driving, I am the president of as well, and I have been for the last couple of years. So we bring awareness to drinking and driving, as well as preventative measures to stop or slow down impaired driving, as well as victim assistance for those individuals that have been affected by drinking and driving as well. So looking at what COVID has done in the community, here at the Community Association, we deliver food and basics to single moms and seniors. So I've had first-hand experience dealing with seniors. And the thing I can say first and foremost is, as many seniors have talked to me as I'm delivering their food, because I've done it myself, the fear of not knowing how they're going to get their next meal, the fear of not knowing how or when they're going to get the resources that they need to survive. And a lot of these seniors didn't have any other family or friends to do it. They're relying on a community association to deliver food. Secondly, the lack of resources. So dealing with these 3 human resources that we did, the biggest problem was connecting people with food banks. I had one individual come in, and he was from Africa, just new to the country, not too long, and he had no food or diapers for his family. So we had to try to find resources for him, and unfortunately during COVID, those resources weren't even open. So he phoned me back, and he commented on the fact that the numbers we gave him, he left messages and nobody got back to him. So there was a huge concern, not only about getting individuals these resources, but also the accessibility wasn't there. And there was a lot of fear in those individuals as well. Going into the mental health organizations, dealing with seniors. So my specialty is seniors within.
Ma spécialité est auprès des personnes âgées dans cette organisation.
These seniors, there's a fear of COVID. I mean, they're in the last years of their lives, and they've been isolated, and the isolation for seniors has been a huge problem as well. Mothers Against Drunk Driving. Well, actually, going back to mental health, 6.2 million Canadians suffer from mental illness in this country, and that's pre-COVID. The numbers going forward will be staggering, as well as the accessibility, because the biggest problem in mental illness is the lack of accessibility within mental health and mental illness. Mothers Against Drunk Driving. You would think with all the restrictions that government has put in place that impaired driving would be substantially down. And it is a bit down, but it's insignificant. The alcohol consumption and cannabis consumption during COVID is actually on the rise. And we work with Calgary Police Services, and the concern is going to be after post-COVID, that impaired driving because people have been sitting in their houses, that it is going to be a bigger problem than it was before. But people are still drinking, people are still driving, and it's actually increased. The amount of alcohol and cannabis consumption has increased. And we just had a case last week of somebody, a 38-year-old who was drinking and driving, killed somebody, and we're very concerned about where this is going. So looking at the problems in the community, it's vast, and we're an organization that know the resources. We're an organization that understand the system, and we're having trouble accessing the system to get help for people in all of the capacities that I mentioned earlier. So COVID has been devastating to this community, the community of Huntington Hills, which is in Northwest Calgary. It's been devastating to the mental health and mental illness we're seeing. I just don't know where this is going, because we had an economy that was challenged. Then we had COVID, and the accessibility of getting mental health resources for anybody, children, youth, seniors, single parents, is horrific, and it's something that I feel very bad for individuals trying to get that help, because it's just not accessible. Thank you, Mr. Chair.
Thank you, Mr. Lundy. We go now to Ms. Chu. Ms. Chu, please go ahead. 6 minutes.
Thank you very much. My name is Queenie Chu, and I'm the CEO of Success. Success is one of the largest social services agencies in British Columbia, serving new Canadians, seniors, and affordable housing. And thank you for inviting me to present to the committee today. I also am very pleased to join you from the unceded territories of the Coast Salish peoples, including the territories of the Squamish, Tsleil-Waututh, and Musqueam nations. The COVID-19 pandemic continues to have an impact on Success, as well as the community we serve. As a nonprofit social service agency, we quickly pivoted our services to meet the evolving needs of our communities. For example, this includes offering supports to newcomers to navigate government benefits and systems, coordinating teams of volunteers to support seniors with grocery shopping, meals, deliveries, and virtual phone visit. And of course, ensuring seniors residing in our long-term care home remain safe and healthy. We also have seen the impact on immigrants and racialized communities. Many are working on the front line as essential workers, often in multiple and low-paid jobs with less job security, which puts them and the family at higher risk of COVID-19. In addition, we also seen a rise in anti-Asian racism at the same time. Recent research by Insight West indicate that there's 43% of Asian British Columbians have been on receiving end of racism this year, past year. To be honest, the true number of is probably much higher, as many people all will downplay their experiences of racism and hate and will not report it. It is likely that many of you know family, friends, neighbors, or coworkers who have experienced racism. The dual pandemic of COVID-19 and anti-Asian racism has negatively impacted the health and well-being of immigrants and racialized communities. Many of the clients that we serve as Success, particularly Asian elders and women, are experiencing very real fears about how about their own and their loved ones' safety, not only from COVID, but also from racism and hate. This has added to their stress and anxiety levels, and we have received many calls from community members reaching out for support. At the same time, we know that there also continues to be many community members who do not reach out for support due to stigma and language barriers as well. So there is so much work needs to be done, and I wanted to put forth a few thoughts for your consideration. First, we need to acknowledge and examine the disproportionate impact of COVID on immigrant and racialized communities. To do this, we need to do much a better job of collecting race-based data in consultation with communities. We need to not only collect this data, but also be open about how it will be used to make positive changes. My concern is always that we only collect data, but it just sits in a report and nothing is done with it to make improvements to people's lives. Next, we need to do more work to understand the short and long-term impacts of racism. While we all acknowledge that racism is a problem, not enough is done truly to understand far-reaching and intergenerational impacts of racism on people's health and wellness. We need to adopt an intersectional lens so that we understand how racism intersects with xenophobia, classism, misogyny, and other forms of oppression. There needs to be more sustainable funding to support mental health and wellness of immigrant and racialized communities, particularly culturally appropriate supports. We receive significant demand for our helplines, counseling services, and we need more funding in order to keep up with the growing demand. And this isn't going away after COVID, which is why I say sustainable funding and not just one-off supports. We need to prepare for the long-term impacts of the trauma from COVID-19 and racism, particularly for those who have been on the front lines of the pandemic. We all know that long-term care homes have been significantly impacted by COVID. There is an urgent need to develop national standards for long-term care to ensure health and safety of seniors who experience high levels of vulnerability. At the same time, we need to ensure that these standards are inclusive of the needs and experiences of diverse seniors by considering culturally appropriate care. We also need to support the sustainability of social service organizations and people who work in the sector. They are critical to the health of the communities. Many organizations have stepped up to the plate, pivoted their services, and quite frankly, gone beyond the call of duty to support high needs in the community, all while dealing with family donation, all while dealing with falling donations levels, underfunding, as well as staff burnout. We need to ensure these social service agencies not only surviving the pandemic, but that they are supported to enhance their capacity in order to respond new community emergencies. Thank you for your time, and I hope that this is some insights that can be shared and for your considerations.
Thank you, Ms. Chu, and thank you to all the witnesses for your statements. We'll start our first round of questioning at this point with Ms. Rumpel-Garner. Please go ahead, 6 minutes.
Thank you, Chair. I only have 6 minutes, so for my questions to the witnesses, if you could keep your answers brief. First, I'll just start with Ms. Chu. Thank you so much for the work that your organization is doing to combat Asian hate. If you do have recommendations on how the government could implement some of the recommendations you talked about, please table that with committee. Mr. Braithwaite, briefly, I know that your organization runs a program called Inclusion for 2S LGBTQ+ youth. I'm just wondering if you have any quick observations or would be willing to table to committee any specific recommendations on addressing safety for LGBTQ youth during this time, given that many of them can't shelter at home.
Yes, thank you very much for the question. I think it's just about providing appropriate and affordable supportive housing, which that's what we've done with inclusion. So with inclusion, it's a very inexpensive way to do it, where the organization is actually renting a home in the community, and then we're working with partners who have expertise to wrap the right supports around LGBTQ2S plus youth moving forward. And I think you're absolutely right. For many youth, including 2S LGBTQ youth, they are staying at home in unsafe situations. We just need to provide more options moving forward. I believe about 25 to 40% of youth who experience homelessness identify as being from this community. We just need to open up more, and it has to be not in as part of another housing program, because the supports are a little different and specialized.
Thank you so much. So the remainder of my question to Mr. Lundy. So Mr. Lundy, you mentioned your organization and you sort of went through the breadth and scope of it. I think that there's a perception that, a lot of people in our community in Northwest Calgary, that it's like, this big wealthy community with all these big trucks and stuff like that. Maybe do you want to talk a little bit about some of the things that you've seen during the pandemic in our community in terms of the impact of both the pandemic and the economic downturn, as well as any recommendations that your government, your organization has for the federal government in terms of recovery and support. I know everything from the community associations across Calgary have really had a hard time raising revenues. Many of them are kind of on the brink of collapse because they don't have the ability to run events or programs as usual, but also the ancillary services that you talked about are being used more and more. So I just wanted to give you a chance to expand on that.
Sure. Thank you for the question. Our community association, like others, as was just commented on, have suffered greatly due to COVID. We are an organization, most community associations are an organization that are non-for-profit, and we've done very well up until COVID, and since COVID, it's been very difficult to run a community association. Secondly, I think that the programs that we do, I mean, some of them due to government cuts, we don't do anymore, provincial cuts, but we still have people coming through the door trying to get help, and it's shocking the amount of people that have showed up at our door that are desperate, in desperation.
Do you want to talk a little bit about the impact of the provincial cuts on your programs?
Yeah. Well, we ran these 3 programs here for 20 years, and we helped thousands of people. Unfortunately, what's happened is government has cut funding to our lone parent, ParentLink, and North Central, and they because they cut that funding, that's why people are coming to us still and saying, where do we go? And we send them in other places, but unfortunately, those other places, the accessibility has been a big problem. So people are not only desperate and fearful, but they're really focusing on they want to get help, and it's not as what was mentioned earlier. The disposable income in our area in Northwest Calgary, in this area, is not high. We have a lot of low-income families, a lot of rentals, and we were always desperate to find the resources needed for this demographics, but now it's even worse. And when we send people to other organizations, and due to provincial government cuts, the doors are closed, or they're leaving messages 3 or 4 times.
And it's my understanding too that the quote unquote programs that have been put in place to replace some of these have not been effective, and they don't actually reside in our community.
They do not. Very frustrating, because we help thousands of people here, and because of provincial cuts, provincial government's saying, "Hey, look at us. We've saved all this money," but they're also not giving the proper resources to this demographics at all. So
I know I find it very unfortunate as well, personally, too.
Very sad. Very sad and heartbreaking. And as an individual too, the aspect when we talk about mental illness, the aspect on us, for me, has been tremendous, knowing that at one time I had all these resources at the tip of my fingers, and I know the system better than most because I deal with it in my mental health organization, and as well as my patient advocacy, and I have trouble getting people to help. So I only can imagine the horrific feelings and mental anguish that people that are low income, that have language barriers, that don't have the same accessibility as what I do, and they can't get the help. And it's about them not being able to feed their families, or not being able to pay their rent, or not being able to do the basics that people shouldn't have to worry about.
Thank you, Mr. Lundy.
Thank you, Ms. Schempel-Garner. We go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead, 6 minutes.
Thank you, Mr. Chair, and thanks to today's witnesses for sharing their experiences with us. I'm grateful for the opportunity to welcome Blue Door to this committee and to have their local perspective contribute to our studies. So I'll be focusing my questions to Mr. Braithwaite. At the last committee meeting, we started talking about homelessness in Canada, particularly during the pandemic. Blue Door has provided life-saving support and shelter for the vulnerable communities in the York region for many years. And Michael, I congratulate you on the way that you've been able to engage members of the regional government, convincing the police chief to sleep in cardboard boxes in the middle of the night. And that kind of creativity has created a lot of community support. But based on your experience over the last year, can you elaborate on the impact and the risk that the homelessness groups have been experiencing, particularly with respect to a reluctance to seek out help out of fear of transmission? How were you able to cope with that?
Thank you, and it's so nice to see you, Tony. There's a lack of trust for people experiencing homelessness. There's not a lot of trust with systems to begin with, right? You'll see that with some vaccine hesitancy as well. There's a lot of fear in going into crowded spaces, and unfortunately with emergency housing, emergency shelter, they're quite crowded sometimes. There's room sharing, there's spaces where they get together, where they eat, etc. And during the pandemic, of course, we, in order to stay safe, we actually had to have people eat in their rooms, which was social isolation, and we had fewer units. Social isolation to a lot of people is they'd rather stay outside than be isolated for 2 weeks. We also had a system where you'd have to go, a transitional system, and it was all for safety. It made sense, where you'd have to go and isolate for 14 days, which was really, really tough, especially when you have you might have addictions or mental health challenges. So you might have to have an alcohol withdrawal program or a drug withdrawal program that you're working through. You might not have access to that if you're isolated. So it really opened up a lot of different challenges for people going in. For youth, there's a reason we have youth, seniors, women's, and other types of emergency housing separated. For youth to all have to actually isolate with adults and families and others, they just weren't doing it. So youth weren't going inside. They were, and it wasn't a choice. They were just saying, we're going to stay outside if that's the only possibility that we do have. We did not end youth homelessness, but we saw, I think it was 17% of youth accessing our transitional housing program to keep them safe. And so the isolation piece is tough. There's a lack of trust, and there's a lot of fear within. And so what we have to do is really be innovative and creative, as we did with a vacant home with Parks Canada, which has 44 vacant homes, and Rouge Valley Park in York region, that we can take those homes, make affordable housing for many, many years beyond this. We have to work with, we did a 200 Doors campaign where 10 organizations came together to work with landlords to see if we can access new rental properties. Not looking for a break on rent, but just really being open to renting to vulnerable people. So we really need to be creative in how we do that. It continues to be a challenge, but it's going to take innovation and creativity. And it also, we worked with a lot of people to prevent them from losing the housing they have now. So getting them through the region, the rent supports they need so they don't lose their housing, and we don't have new people coming into homelessness.
Mm-hmm. Now, I know that you run 3 programs, Leader Place, Porter Place, and the youth shelter. Now, could you elaborate on those 3 programs and how you might have had to change the provision of services specific to those programs, or was it general? And how have each of these groups been impacted by the pandemic?
Sure. Well, we run our youth emergency housing, Kevin's Place, which is in Newmarket. It's in a house, and we actually couldn't at first run that safely because they were shared accommodations. There was all shared common spaces. So we actually had to move the youth in with men at Porter Place, our men's emergency housing program, which was not ideal. There's a reason we separate. They have different needs. So that one was shut down for a while. It's now back operating, but at a smaller scale. Our families, actually, we worked with the region. We used our family site as the isolation site for the entire region. So for the 9 municipalities that serve as isolation site, our families moved to a hotel for about 8 months or so, and then we moved them back to the site. We've had to cut down a little bit to allow for spacing there, and they can't use the common rooms, and the kids can't play together, which is tough. So that's been fairly tough. And with our men, what's happened too is that everyone in York Region goes through a transitional site first for 14 days, and then they, usually they would just enter into whichever site made sense for them. Now they go through the transitional site. So the clients we're actually seeing in all of our programs are the hardest to house, because the easier people to house that might need a little income support or just help finding a home are that happens in the first 14 days transitional site. So what Blue Door and others are seeing when they see those clients are what we call high acuity, people with higher needs, larger families, people that are not employed, people that have more severe addictions, mental health challenges, so they're harder to house. So the number of people we're housing, and especially it's hard to see places too, because they're only doing virtual open houses, if at all. So it's become quite a challenge to get these individuals and families housed.
Thank you. You're doing a great job, Michael, and I appreciate the way you're working in our community.
Thank you.
Thank you, Mr. Van Bynen. Nous allons maintenant, Monsieur Thériault.
Mr. Thériault, your turn. You have 6 minutes. Thank you very much, Mr. Chair. Let me thank all witnesses for their testimonies, which are helping us understand the collateral effects of the pandemic. First of all, my questions will go to Dr. Perrault. Dr. Perrault, thank you for taking time to come talk to us. You've been practicing emergency medicine, so we will take advantage of your presence. I'd also like to thank you for the quality of your testimony. I dare say that you were as precise as a surgeon would be. Everything was clearly summarized, and your voice adds to what Dr. Belanger said, Dr. Champagne, the Cancer Society, the Canadian Medical Society, Dr. Shaba. First of all, the first statement that frightens me is that we're trying to maintain list of 25% for people who are received beyond the acceptable deadlines, and now we're up to 40%, and that the risk is sudden death. Could you please explain the situation to us better? The experts that appeared before us from the very first moment said that our health system had been weakened because of chronic underfunding that had existed for many years. We don't know what is going to happen. That was during the first wave. Now we are going through the third wave. Are you concerned? Of course. I hope that I highlighted that point. The lack of access to the health system that occurred with COVID through the first wave and the second wave and so on. And as it extends, the greater the long-term effects. So we may take many years to catch up if we do not provide funds as a matter of urgency. Some provinces are talking of 2.5 years. In Quebec, the number of interventions that are backlogged have been evaluated at more than 100,000. So there are going to be long-term impacts for us to be able to catch up, with some success. Something else, the deadlines for investigations and lack of accessibility have led to a situation where we'll have even longer-term impacts beyond 3 years. So it's not by providing sporadic funding that we will be able to have a long-term impact. Maybe the image I will give may be strong, but we shouldn't be sacrificing a generation that will take decades to correct if we do not react right faced with the current situation. We have no idea whether there will ever be a post-COVID situation. We must bear that in mind. So in the same way, as in oncology, we are expecting an explosion of cost. Same thing for cardiovascular care and cardiology. If we are not able to take preventive actions, if we are not able to take early action, we must expect an increase, an explosion of costs without taking into account the consequences on patients. Is that what we should understand? Absolutely. Another thing I wanted to say is that sometimes we imagine that cardiovascular patients are people on retirement, people who are not working, but many of our patients, particularly with the increase in risk factors like obesity, are young people who are working. And if these people do not receive care on time, they can't go back to work. And then they become dependent, and this affects their quality of life, and they require more resources. So that will be a lost opportunity that we'll never gain back. So this has a personal impact for people and also an impact on the system. And now we're not even talking about the waiting list in orthopedics, which in the medium term also have an impact on the cardiovascular health, because the longer we wait, because we have difficulty walking, we have difficulty getting up to exercise, the more patients we'll see with these problems. So, Dr. Peru, the government is now telling us in the middle of a pandemic that they will take care of COVID patients first, inject money sporadically, and then add significant, foreseeable, and recurrent sums towards the health transfers only after COVID. Do you think that from a medical point of view, this is a good approach? I think it's a risk. We've already seen the consequences on non-COVID patients, and I hope I clearly described the situation during my statement. If nothing is done for this majority of people, and there are many of them, and it remains a minority from all COVID patients are still a minority compared to all those suffering from cardiovascular diseases and so on. So we need to act where necessary. So I don't think we can afford to wait longer. We cannot predict for sure when we will overcome the pandemic. And for each day that goes through, and we do not help non-COVID patients, it's a missed opportunity with long-term consequences. Thank you very much, Dr. Peru. Thank you. Thank you, Mr. Terrio.
Mr. Davies, please go ahead, 6 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for your testimony. Mr. Braithwaite, you mentioned the definition of affordability at 80% of market. Whose definition is that?
That's CMHC.
So the federal government defines affordability in Canada as 80% of market. And I take it you think that's too high, that's an inappropriate measure?
Absolutely. Your average room in larger Canadian cities, a room in a house will be $700 to $900. So if affordable is 80%, say, of $2,000 for a one-bedroom apartment, and people who are receiving government assistance, some of them are their income is $700 total in a month. There's a huge gap there.
Thanks. And second, approximately, if you know, how many homeless people are there in Canada today?
There's approximately 235,000 people who will experience homelessness on any given night.
And has that number gone up or down in the last 5 years?
Unfortunately, that number has continued to climb.
Thank you. Ms. Chu, you mentioned intersectionality in racism. I'm just wondering if you could explain to us what have been the effects of the increase in anti-Asian racism on a gendered point of view, men to women, and also I'm interested in how that's impacted Asian youth.
Absolutely, and thank you very much, Don, for your question. And certainly racism, especially in all its forms, especially anti-Asian racism, has been hitting the peak and is going to climb, during COVID and also beyond COVID, unfortunately. And certainly, it's not just people of colors, but also looking at people who have xenophobia, classism, misogyny, and all forms of and all other forms of oppression, definitely impact the people's health and wellness, and also instilling the fear among us in the communities, knowing that certainly this is not that our value of Canada, and especially for newcomers when they come to Canada, hoping for a new life and hoping for a welcoming country to settle. However, this is not even the case. So this is a real fear and real problems that we needed to deal with, and this is not something we could just ignore.
Thanks. Ms. Chu, can you outline any barriers that immigrants or newcomers to Canada have been facing when accessing healthcare related to COVID-19, such as testing or treatment or vaccination?
Absolutely, and thank you very much for the question. And certainly, one is when we're facing such COVID-19 pandemic situation, it affects all of us, including the newcomers in Canada. One is they've been facing a lot of settlement, and cultural barriers, let alone that they have to think about the safety and the concern about COVID spreads and how they're going to access the testing, how are they going to navigate themselves online. Many of them might not have the technology skill nor the ability to have even internet, affordability of internet nowadays, right, for them. So it is very important to look at what are the, all those barriers in order to support those newcomers, especially refugees. And it is crucial to make sure everybody understand this is important for all of us to play an important part so that COVID-19 will be eradicated, and we are hoping to support those most vulnerable people as well when they're facing financial hardship, cultural differences, and language barriers.
Now, I think all of us have seen some really disturbing incidents of anti-Asian racism. I know in Vancouver, I've seen some situations that happened in Richmond where Caucasians were accosting people of Asian descent and hurling abuse at them. Very rarely do we ever see any charges under Canada's hate crime legislation. I'm just wondering, do you have any suggestions for this committee as to what are some of the best strategies for dealing with this? Do we need to relook at federal legislation? Is it a question of education? Should there be a national education program on racism? What would you suggest we could do to help address this?
Thank you again for the question. I think it's above all what you just said. And I think I mentioned about we need to acknowledge and examine systemic racism across all institutions. And we need to collect race-based data and in consultation with the communities so that they understand, what was collected and how that is being used for improvement. We need to have adequate funding for anti-racism initiative, not piecemeal funding, but sustainable funding to create long-term impacts. And the other piece is important to build supportive and safe communities, such as funding the initiative that empower community members to speak out and intervene against the racism when they witness it in the communities. Supports like crisis counseling, helplines for those experiencing racism and long-term trauma from it. The last but not least, I think it's so important to fund education about historical and contemporary racism in Canada and in all its forms, because there are people who are directly affected by racism, but there are people who actually have no idea how they impact to their neighbors, to their peers, to the fellow community members. So it is important that we need to be all inclusive in terms of providing support to people and education and training to people.
Thank you, Mr. Davies. So committee, that brings our first round of questions to a close. I believe we will have time for a short second round. 1 minute rounds for each party generally works out to 8 minutes. So let's go with that. So with that, we will start with Mr. Maguire, I believe. Please go ahead, 1 minute.
Thank you, Mr. Chair. I'd just like to direct a question to you, Dr. Perreault. How many people, you mentioned the closures of COVID have caused big delays. How many people do you think have died of cardiac procedures here, lack of cardiac procedures while they've been waiting on a list to get those procedures due to COVID?
Well, we are presently trying to get an estimate that we do have the exact numbers is hard to say, but I mean we're talking probably ballpark dozens, and what we know is definitely what we've analyzed is that the number of people usually showing up, let's say for a heart attack, have been going down quite a bit. So some of the people, if they die at home, we never know whether,
So that's another consequence of the whole situation.
So and on waiting lists, obviously we monitor them, and one is too few, but around the province of Quebec, we can say that there's a couple in each of the centers.
And to Dr. or to Mr. Braithwaite, you talked about the affordable housing and the 80% of the market. The housing strategy you said is needed everywhere. Can you just elaborate on what you think a long-term care facility housing strategy would look like, and how that would include having seniors stay in their homes longer? Your thoughts on that?
Yeah, a lot of that is around just income supports and bringing the supports to the individuals, and also matching the supports with what their needs are, especially for seniors. So for seniors, their supports might look a little different. Personal support workers, income support, keeping them in their homes as long as they can, and keeping them safe. And I think that's a lot to do with prevention work as well. We can prevent people from falling into homelessness if we invest in the forefront.
And Ms. Chu, could you?
Thank you, Mr. McGuire. Go ahead, Queenie. Quickly, please.
Thank you very much. I really feel that everyone has a right to safety, respect, and inclusion. And this is very real for us, for every Canadian. And I think this is so important to ensure of all ages, of where they come from, and also people from the racialized community, that this is very important for us and to be supported and provide them with safety, respect, and we wanted to create that inclusive community.
Thank you, Ms. Maguire. We're going now to Dr. Pawlowski. Dr. Pawlowski, please go ahead, 1 minute.
My question for Dr. Perreault, of course, a lot of people have had their surgeries canceled during COVID, but I would think this has really disproportionately affected cardiovascular surgery because the ICUs in Ontario, Quebec are full up with COVID cases. If you get your appendix out, you don't go to the ICU afterwards, but a lot of your cases, I think, do end up going to the ICU. So can you tell me how this has really disproportionately affected your ability to do important cardiovascular surgery? Thanks.
Well, in the province of Quebec, basically, in the first wave, the capacity for heart surgery went down to almost 20%. And you are right, 100% of our patients do have a stay in the ICU. Most of them is a short stay. I'd say 60% or 2/3 is only 24 hours, but they do need acutely. Initially, because of preventative measures to try to make room, a lot of the system was shut down, but very too cautiously. And obviously, the strategies to decide where the patient should be going should be looked at in the sense of maybe COVID patients should not be all across different hospitals, but they should be concentrated. There should be COVID-free hospitals, COVID-free cardiovascular centers, so that there could be, operations that keep going on. But definitely, there was too precocious and too extensive shutdown during the first wave and the second wave.
Thank you, Dr. Pulaski. We'll go now to Monsieur Thériault. Allez-y, s'il vous plaît, 1 minute.
1 minute, Mr. Thériault. Dr. Perrault, we know that when it comes to cardiovascular diseases, many patients have the disease recurring. Is that something you've observed during COVID? It's inevitable. We talked about prevention a while ago. It's clear that all those aspects were considered as primary prevention, prevent the disease. But secondary prevention is intended to reduce disease recurrence, and that has been ignored. And all these have long-term consequences. I want to call on decision makers to think of non-COVID patients and also think about the long term. To respond to Mr. Maguire's question, you talked about non-COVID patients on waiting list. But those on waiting list, are those people who were diagnosed already and waiting for surgeries? Well, we are not hearing about those who are still waiting for screening, those who are invisible now. Exactly. And that's the tip of the iceberg, people on the waiting list. But we do know that there are delays in investigations. Cardiologists have realized that patients are not showing up. So that's simply the tip of the iceberg. Thank you. Thank you, Mr. Thériault.
Mr. Davies, please. Go ahead, 1 minute.
Thank you. Well, Ms. Chu, I'd be remiss if I didn't, on behalf of British Columbians, thank you and success for the excellent work that you do in our community in so many areas. So I just want to go on the record for that. I want to ask you about any increase in demand for your counseling and crisis support services through the COVID-19 pandemic. Do you need additional resources or funding from the federal government? Have you found your services are more in demand now?
Absolutely. The escalation of issue about these areas certainly call for a lot of support and financial, especially financial support, to make sure people's mental health is supported and being well. And certainly the crisis line and crisis counseling and helpline has increased fourfold from the before COVID. And we're hoping to have additional funding to support the increasing demands for those people who have been suffered or witness of those racial situations. So definitely we need funding to support this.
Thank you.
Thank you, Mr. Davies. And thank you to all the witnesses for your time today and sharing with us your knowledge, your expertise, and your concerns. And thanks to the committee for your great questions. We will now suspend and bring in the next panel. We are suspended. Number 32 of the House of Commons Standing Committee on Health. The committee is meeting today to study the emergency situation facing Canadians in light of the COVID-19 pandemic, specifically today examining collateral effects of the pandemic. We will start our witness statements here. We firstly welcome our witnesses. From 360 Kids, we have Clovis Grant, Chief Executive Officer. From the Federation of Medical Specialists of Quebec, we have Dr. Serge Legault, Vice President. With Food Share Toronto, we have Paul Taylor, Executive Director. And with Madikale Touring Incorporated, we have Mr. George Cannon, Owner and Chief Executive Officer. Renee Dog Productions Limited, I think I messed up that name, I apologize. I should advise the committee that the clerk did send out Mr. Canyon a headset, but he didn't receive it. And it's one of the important reasons why we have to give ample notice to the clerk for witnesses so we can get the equipment there and test it out. So thank you all for coming here today. And we will start with our witness statements at this point. We'll start with 360 Kids. Clovis Grant, please go ahead, 6 minutes.
Thank you. Through you, Mr. Chair, thank you for the opportunity to speak to the committee this afternoon on behalf of 360 Kids. As one of the leading youth agencies in York Region, 360 Kids has a 32-year history of providing services to homeless youth, including victims and survivors of human trafficking. We serve approximately 4,000 youth each year, ages 16 to 26, providing them with education, housing, employment, and health and well-being supports. Our mission is to transition youth from crisis to stability. So the impact of COVID-19 on 360 Kids. Well, first, let me share some comments from the young people themselves. First, being told to stay inside and not leave reminds me of when I was being trafficked, and this causes me a lot of anxiety. Second comment, for those of us who have no place to go home to, it's hard to do the things we are told to do, such as staying home, washing your hands. How can you do that when you don't have access to water? You can't even take a shower. So then what are the lessons we've learned through the pandemic? Well, 5 things. First of all, great things can happen when we work together. Second, prevention is indeed the best medicine. Third, the marginalized become even more marginalized during a pandemic. Number 4, youth need very specific solutions. And lastly, the needs of staff must also be prioritized. One of the successes of the pandemic that we've seen is organizations coming together, providers from various sectors in York Region, including government, funders, private corporations, coming together to share resources, their own responses to the pandemic, and collaborating on initiatives. We were able to identify gaps very quickly and respond in real time to address needs for food, technology, housing access, etc. I really can see these built relationships continuing into the future. Our work at 360 Kids on prevention, leading the youth housing stabilization strategy, developed even more significance during the pandemic. This is a group of about 30 cross-sectoral partners and young people working together to better align services and resources to prevent youth homelessness in York Region. Why? Well, we know that homeless youth become homeless adults. And the longer you're homeless, the worse your outcome. And we definitely saw how the marginalized became even more marginalized during the pandemic. In our programs, we saw a 5-fold increase in the numbers of youth accessing mental health supports, with past trauma, loss of income, confinement due to lockdowns, all contributing to high levels of anxiety. We need more accessible mental health supports, especially for this population and for those who are Black and racialized. The youth told us that racism was a significant factor in their homelessness. And to address these impacts, we had to provide various spaces for the young people to share their voices. We expanded partnerships with specific cultural agencies. And at the same time, we reviewed and are updating our own agency equity strategy. The need for more youth-specific solutions was seen when we closed our drop-ins early in the pandemic. One of my earlier quotes spoke of the challenge some youth who are precariously housed face. we saw that youth living in the rough, that these are the youth who are living in abandoned buildings, abandoned cars, abandoned spaces in general, many of them went more into hiding due to the closure of many of the spaces they once went to. To better support the youth, rather than waiting for them to come to us, we went to them. We redeployed staff to do more outreach. We even hired 2 young people to be outreach workers who are former youth. And we also pushed for a youth-specific isolation facility to make it more accessible for youth to get access to housing. While we were able to house about 25 youth throughout the pandemic, we know that the need for more affordable housing is so critical. We certainly applaud the government for funding the emergency and short-term needs, but without longer-term housing and wraparound supports to keep people housed, those marginalized young people become even more marginalized. I close with a reminder about the impact of the pandemic on our staff. Confusing public health messages, concerns about the vaccine, low wages, even the stress of their own family situation, they all took their toll on staff mental health, worsened with each lockdown. We responded as an agency with additional mental health days off with pay for staff and with flexibility around their sick time and their childcare needs. The government funded additional hourly pay given to frontline workers for a brief period last year certainly went a long way in recognizing the importance of this sector that is chronically underpaid. And we hope to see this kind of support continue. Unfortunately, for many agencies like ours, who are not adequately funded for our programs, it puts pressure on our fundraising, and we have seen a significant hit to our fundraising due to event cancellations over the past year. So in summary, it really has been a very difficult year for the young people we serve at 360 Kids and the staff who are supporting them on a daily basis. While emergency responses are great, and we saw some great opportunities as well throughout the pandemic, what is more important are preventative measures and wraparound supports to get people housed and to keep them housed. Thank you for the opportunity to speak with you.
Thank you, Mr. Grant. We'll go now to Federation of Medical Specialists of Quebec. Dr. Legos, s'il vous plaît, allez-y.
You have 6 minutes, sir. Dr. Lego. Thank you, Mr. Chair. I would like to thank the parliamentarians for inviting me and giving me the opportunity to come discuss the impact of the global pandemic of COVID-19 on Quebec patients. My name is Serge Legault. I'm a general surgeon working in Laval, Quebec. I'm vice president of the Quebec Federation of Medical Specialists. From the beginning of the crisis in March 2020, I've been sitting on a national committee called the COVID-19 Steering Committee that was set up by the Ministry of Health and Social Services of Quebec. The objective of this committee is to find ways to try to advise the ministry on the most prudent strategies to adopt during the strategy. I'm also president of the operating blocks, a subcommittee responsible for offloading strategies during COVID. We've learned a lot over the past year, and our responses to COVID-19 have been adjusted with time, and I will talk about it if you're interested during question period. The Federation of Quebec Medical Specialists has 10,000 specialists, 59 different subspecialties, imaging, lab, and so on, working in the public health sector. Since March 2020, the medical specialists have been working on 2 fronts. The first is fight COVID-19 at the hospital, that is at the intensive care units, on the floors, and in the operating room, to save the lives of patients affected and to try to save the most lives possible. This affront from an infectious disease is one of the worst we've seen in modern history of medicine. And of course, doctors, managers, and stakeholders in the health sector have tried to adapt as much as possible. The second front is to fight the impact of COVID-19 on the continuum of care and the management of non-COVID patients who exist. and who have been forgotten for a long time, and this for 14 months. Today, I would like to focus on human resources. Right now, I believe it is the same situation everywhere. The health systems are overburdened. The most striking problem is human resources in Quebec hospitals. COVID-19, besides overturning our lives, turning our lives upside down, also upset the fragile balance that existed in our resources. These are people on the bedsides of patients, working day and night to take care of patients from the moment the patient comes to hospital until they leave. Today, because of the impact of COVID-19, either because of absenteeism, illness, career reorientation, many of these resources are absent, some on a permanent basis. This drop in resources is one of the most alarming phenomena right now with the COVID-19 situation because of this lack of resources and because of the offloading efforts that have been requested everywhere in Quebec during the first wave, particularly. Most of surgeries were cancelled or postponed. Some activities for some patients, some operations, for example, were delayed from the beginning of the crisis. At the beginning, 1% of patients had been waiting for 1 year, and now the deadline is even longer, and these are astronomical figures. As of last week, there were about 150,000 patients on waiting list for surgeries in Quebec. 150,000 Quebecers waiting. That's the equivalent of the population of Saguenay or Lévis. Sometimes we talk about those figures without those figures meaning anything to anyone. 150,000 patients is enormous. If the same rhythm continues, that is 40% of normal activities reduced because of lack of human resources, we will get to 200,000 patients on the waiting list, the equivalent of the city of Sherbrooke. Recently, the Federation had the privilege of talking with Mr. Marc Hubin, who was a partner in the response in British Columbia to respond to COVID-19 in operation rooms. MPs, you would agree with me that the British Columbia experience was a success story, and great ideas were implemented and to respond to the pandemic. Of course, at the beginning of the crisis, there was a significant lack of personal care workers. There were initiatives taken to recruit more in Quebec. 10,000 personal support workers were working. Some are still working. It's not only personal care workers are needed. We need highly trained nurses, particularly those working in operation rooms, respiratory therapists, perfusionists, and of course, I can't state all the resources we need. We still need lots of resources. And one of the ways of resolving this problem is through money. The Quebec Federation of Medical Specialists feels that Quebec needs more money to recruit staff, to increase the quality of their work, the quality of the working conditions, to make those positions more attractive because they are key positions in hospitals. Very demanding jobs. It's very easy for human resources like that to become discouraged. If the financial conditions are not there, they may decide to go elsewhere. A polyp that is not removed, for example, today from the colon could end up becoming colon cancer. As one of the previous witnesses said, primary prevention and secondary prevention have been put in the back burner because of COVID-19, as Dr. Perrault said previously. The Quebec government disbursed some money to cushion the shock. We do hope that more funds could be provided to the provinces from the federal government so that the public health system will not disappear. Thank you very much. Thank you, Doctor.
To Food Share Toronto, Mr. Taylor. Mr. Taylor, please go ahead. 6 minutes, please.
Yes, thank you for the opportunity to appear before you today. My name is Paul Taylor. I'm the Executive Director of Food Share Toronto, an organization that works in partnership with communities across the city. We serve as a catalyst to advancing meaningful solutions to food access injustices. So we do this by advocating for the permanent dismantling of the oppressive systems that cause food insecurity in the first place, one of which we know is racism. The very fact that Black households are 3.5 times more likely to be food insecure than white households in Canada is an example of how anti-Black racism causes food insecurity. The anti-Black racism that we experience that causes disproportionate food insecurity is literally making us sick and taking food out of our mouths. It affects our income levels, access to education, housing, employment, and a list longer than we have time for today. It's important for me to start there because COVID-19 didn't create this reality for us. These inequities existed long before the pandemic. But when you add COVID-19, the result has been that Black Canadians are infected and hospitalized at disproportionately higher rates. We're also 3 times more likely to know someone who's died from the virus. Every day, I worry that I'm going to get a call, I'm going to see a post notifying me that I've lost someone in my community. That kind of grief, sadly, is not new to us. Neither are the ways that our calls to address these injustices have gone ignored. Here we are, smack dab in the middle of the 3rd wave of this deadly virus, the collateral impact of which is that our community continues to suffer disproportionately. One of the ways that we're seeing this play out in this pandemic is the way that the pandemic has induced delays of surgeries and visits to our doctors, whether it's for a checkup, to address an existing or a new health issue. We're not able to get the help that we need right now. I've long said that I believe that we only have a sick care system in this country, but ultimately we've been forced to depend on it because it's all that our government seems to prioritize. I say a sick care system because a healthcare system wouldn't be divorced from ensuring things like access to nutritious food and housing for us all. But again, it's all we've got at the moment. The result of these type of delayed visits to doctors and delayed surgeries will be our worsening health and the deepening of health inequities for a generation. Instead of prioritizing our health, I mean our actual health, the reality for Black Canadians is that we are sentenced to things like food insecurity and now less access to vaccines, less access to testing, and even more policing of our communities. Ultimately, more government-sanctioned injustice targeted at Black Canadians. At the intersection of my identity proudly exists both my Blackness and my queerness. Growing up materially poor, gay, and Black means that many of us don't always have the typical family support systems to fall back on in times of need, in times of a job loss, or in the onset of a serious illness like COVID-19. Not to mention that many in the queer community work in the arts and hospitality sectors that have been decimated by the virus, making, again, queer folks especially vulnerable to food insecurity, homelessness, and the health impacts that come with both. Like any group, in times of tumult, we cling to our community for support. Many of us find chosen family in our community spaces, ones that are safe and accessible, safe space that we have long been losing thanks to gentrification. Week after week, another of our community spaces or queer-owned businesses shuts its doors for good. We shouldn't have to suffer more as a result of this pandemic because we're queer or Black or trans or disabled or low income or a refugee. We all deserve to be protected and kept safe, especially in a crisis like this. Thank you.
Thank you, Mr. Taylor. We go now to Medicaid Touring Incorporated with Mr. Cannon. Mr. Cannon, please go ahead. 6 minutes, please.
Thank you. Good morning. Thank you to all the members and Mr. Chair for having me on as a witness. I will try not to be too long-winded, but I was born and raised in Nova Scotia, as Chris knows, where we like to tell stories. Right now, I currently live in Alberta, where I've lived for more than half of my life, just south of Calgary, actually 5 minutes south. I've been in the entertainment business, music business, for approximately 30 years, very blessed. And up until COVID-19 hit, I had a very successful career internationally in the country music niche. I've also been a recording artist, audio engineer, and video engineer for the aforementioned 30 years, and have worked not only on my own career, but more importantly, I've aided in the mentorship of dozens of young artists and charitable causes. COVID-19 has decimated our business and our industry as a whole. We immediately made moves, of course, as all good change managers do, to pivot, to try and find some economic resource for our entire team. Not unlike the time we had to pivot a few years ago when our industry introduced streaming, where my company went from 6 IPs overnight to 1 IP and lost 60 to 70% of its revenue generation. However, hours and hours of free online concerts and virtual appearances brought basically no economic relief, albeit with music, and I'm sure everyone here appreciates music. It made us feel good to be able to bring some solace and comfort to our fans with what we've been blessed to give in music. We were one of the small businesses, and I would say few, but unfortunately the more small business that I've talked to, especially here in Alberta, we were one of the few to fall through the cracks when it came to receiving any kind of federal relief economically. In fact, we have a wonderful team of accountants and business managers that work with us, and they've been trying for months to access that funding to no avail. So our situation now is our entire team and staff, of course, have been laid off, and I would love to be the artist that gets to cry over spilt milk, but this is not just about me. It's about 3.1 million people that are affected directly in the entertainment business, that don't have work to go to, that are receiving no funding and help. And more importantly, hope to us is everything. We have nothing to hope for, because every time something seems to open up, like the shows I was supposed to do that have been moved multiple times, all of my staff, all of my team, all of those venues are now sitting on their hands again, not knowing what's coming. And that right now is the absolute worst part on our mental health, is not knowing what's going to happen a month from now, 2 months from now, 6 months from now, if you're going to be able to feed your family, if you're not, if you're going to have to take subsequent work. Like, I've talked with many artists and musicians and techs that have been blessed to find other jobs that will never, ever come back to the music business, to the entertainment business. They will stay working the jobs they've found because, and it's actually, it makes sense in the rationale, that when the next pandemic hits, we will be the first to be shut down yet again. Albeit, we treat our clientele with the utmost of safety. I would say over most industries, our insurance, our security, our clientele are put above everything else in our business. And unfortunately,
maybe at 1 o'clock we could go to the school to get your other computer. What?
Dr. Pawlowski, you might want to mute.
Well, what time's good for you then?
My computer's here. Anyway, I could go on and on, but I think it's more important that that you get the opportunity to ask the witnesses direct questions. So I'll stand down now and wait for those questions. Thanks again for having me.
Thank you, Mr. Cannon. I'm not sure if that was Marcus I was talking to, but someone. There we go. So thank you all for your testimony. We'll now start our rounds of questions. We will go with Mr. Barlow to start with. Mr. Barlow, please go ahead, 6 minutes.
Thank you very much, Mr. Chair, and thanks to our witnesses for appearing here today and sharing your stories with us. Mr. Canyon, I want to start with you, and you mentioned at the beginning of your presentation something I thought was interesting. Certainly spoken with many artists in my riding, and it simply thought themselves, Yeah, Mr. Chair.
Sorry, Ms. Barley, you cut out there for a minute. I'm not sure if it was just me or.
I'm getting the unstable internet message on my screen, so the joys of rural Alberta, I guess, a little bit, but we'll carry on. So, Mr. Canyon, you were talking about being considered a small business and not qualifying for many of the federal programs like CERB and CEBA wage subsidy. Why are you not? What are the obstacles that are keeping the music industry from qualifying for those programs? Maybe you in particular. What has been the stumbling block?
Well, thank you, Mr. Barlow, for the question. One of the biggest things, and I'm no expert in this field, albeit I've done the economics for a business for 30 years. We have a company out of Vancouver called Yaletown Financial who handle all of our business management needs, and that's all in and outgoing funds. They have informed me over multiple phone calls. One of the biggest issues for small business, when the ownership, myself and my wife who own our companies, do not take salaries and basically at the end of the year you get dividends, it causes kind of an economic loophole. And that loophole has been the issue. They've been working both provincially and federally to try and gain access to those monies, which are so needed just in the downstream to support our team, to no avail. And there are many other reasons economically that they're having issues internally, but it stemmed right back to the first day when they were online trying to fight with the online system. I have talked to others in the music industry, and I to not just pick on one side, and they were able to gain access to funding, but they were a much smaller company and were not an incorporation that were taking dividends. And I think in a lot of small business, that seems to be the biggest issue, is those companies where their owners are taking the dividends instead of the salary. That caused a big issue right out of the gate.
Yeah, thanks for that, Mr. Canyon. And certainly, some of these programs have not proven themselves to be agile and been able to address some of these problems. For the longest part of the beginning of the CEBA account, for example, if you are a small business owner but used a personal account rather than a business account, which I'm assuming many artists who are on a smaller scale than yourself would probably do, they would not qualify. And that took, 10 months to a year for the Liberal government to make those adjustments. So certainly unfortunate when you see some businesses falling through the cracks.
The sad thing is using the word business, John. Our business is not a business of, hey, I'm going to do this, I'm going to punch a time clock from 9 to 5. There's so much passion and there's so much of a piece of yourself that goes into it that when I talked to one of the artists lately who's basically just quit, they could barely speak. They're in tears because it's a piece of them that is just being killed. It's a piece of them that's dying.
Yeah, you bring up my next question. I talked about this on Friday. I had a young girl in my riding call me, in tears about her brother who had committed suicide. Well, I had another one yesterday. A 29-year-old young man in my riding committed suicide yesterday, and these are becoming all too common. And speaking with some of the artists, Mariah Stokes and Lindsay Butler in my riding, you can tell the stress and anxiety that is on these young artists. Maybe touch on that a little bit. What has been the mental health aspect of this? To see your entire industry, your entire livelihood, everything you've worked for, to come to a screeching halt with no light at the end of the tunnel as we continue to see lockdowns and restrictions.
Well, as a Canadian citizen and a very, very proud Canadian, 1,000,000% Canadian through and through, one of the things that disappoints me the most is that we didn't take a deep breath and look at what could be a huge travesty to our mental health, especially when mental health is first and foremost on the minds of most Canadians. In our industry, especially right now, because we have not recovered in the slightest 0.001% at all, mental health is a huge issue. Just in talking to my team, which I try to maintain contact with, make sure everybody's doing good. Everyone's trying to hold their head up and put a smile on, albeit fake. This is what we do in our industry. We're in the industry of hearing no. I've heard no so many times. I just kind of expect it now. When you're an artist and you're trying to get record deals, or you're trying to get gigs, you're trying to climb that corporate ladder. The artists, though, right now that I've talked with as of late, they just feel lost. And it's not so much the artist in me, it's my family that made the sacrifice for us to get to where we are today after 30 years, my wife and my children, and the sacrifices they've made, not just in my wife having to work 3 jobs at one time so I could play on the weekends, but my children not having their dad there for the first day of school, not having their dad there when they learned how to ride a bicycle. All those things add up to mental health. And now looking and seeing their dad just not being able to work for what they have been a really, really big part of my success.
George, I got one quick question left for you, and thanks, Mr. Chair. I see that. We always talk about the artists here, but how many people would you be employing at a typical show? So it's not just the artists that are suffering through this, it's those reciprocal jobs. How many people would you be employing for a typical show that you would be putting on? And what's the impact for those careers as well?
On average, you're looking at probably, depending on the venue size, 100, and that includes our people and the venue people, and then all of those people that are affected outside of that circle. Big tours going into arenas, you'd have 100 techs alone loading and unloading trucks. So you're talking about thousands of people when it comes to the larger tours that we've been blessed to be on.
Thank you, Mr. Barlow. We'll go now to Mr. Kellaway. Mr. Kellaway, please go ahead, 6 minutes.
Thanks, Mr. Chair, and hello to my colleagues, and a warm welcome to our witnesses. A Cape Breton Council welcome. My questions are going to be directed to Mr. Grant. And first and foremost, Mr. Grant, I consider you and your organization an expert on youth and youth programming. And for many years, in the first part of my career, I worked with a gentleman by the name of Gordy Goss. And Gordy was a great man. He passed in 2019, but he was a great man. He worked in Whitney Pier as the youth programmer in Whitney Pier, and later went on to become an NDP cabinet minister in the provincial government. I learned so much from him in terms of the importance of programming, the importance of community engagement. And, this year, Mr. Grant, Canadians have made great sacrifices, and in particular, youth and children who've given up, as you say, going to school, going online, spending time with friends, and really getting the most out of their adolescence and childhood. And the public health measures in every province, they're implemented by the public health officers, and they're important. But, we do need more and varied supports, as you mentioned. In particular, you hit upon something I think was really important, and that's around the mental health amongst youth. And they were already, I think you would agree, at a higher risk, even without a global pandemic being thrown into the mix. So I'm wondering if you can tell me and tell the committee how important it is for children and youth to have access to platforms like Wellness Together Canada, launched by our government, or the Kids Help Phone in these times.
Very good and important question. So as we know, just being homeless, there's a high level of anxiety, high degree of stress, addictions that come with that. And this is pre-pandemic. So you add the notion of a pandemic that exacerbates an already challenging situation. And so the need for the services you mentioned, the Kids Help Phone, et cetera, is critical during those times. And we've seen just with 310 COPE is here in York Region, Canadian Mental Health Association, like all of those organizations.
Excusez-moi, l'interprète dit que c'est impossible d'entendre correctement.
Those organizations doing that work.
Pardon me, Mr. Grant, just hold up there for a minute. Sorry. I'm sorry, Mr. Thériault, you have a problem with the translation?
Oui, l'interprète m'indique qu'elle est incapable de faire l'interprétation des propos de M. Grant puisque le son n'est pas bon. Peut-être que si M. Grant relevait un peu son micro entre le nez et la bouche, le relever un peu plus haut, oui. Plus haut encore, peut-être. Ça serait peut-être mieux plus haut encore.
Yeah. Mr. Grant, say a few words before we begin your time again. So just make sure that the translation is working.
Is that better? Does that work better?
Non, le problème...
The problem is that the microphone is too close to his mouth.
Let's see if we're good
does that
to go.
work better?
Yes.
Okay.
Interpretation, are you good with that?
Could he please say a few more words so we could test?
Is this better? How about this now? Okay.
Okay.
Okay. Sorry about
Merci,
that.
Monsieur Theriault. Thank you, Mr. Grant. Resume your time now. Go ahead.
Okay, so as we know that pre-COVID, pre-pandemic, the need for mental health service for a homeless population was high to begin with, and we know from research that it is just one of the challenges, whether it's a cause or an effect of being homeless, and so the need for those kids' help phone services, the Canadian Mental Health Services, 310 COPE, all of those things were important pre-COVID, and you add a pandemic where you've added a whole bunch of uncertainty for these young people. They've already experienced uncertainties in their lives, and this just further exacerbates. And one of the things that I think it's important to note that a lot of money does go into mental health, and we've seen governments increase those funding. What we do find is many of those services are not accessible for a homeless population, and so for different reasons. And sometimes with a youth population, the definition of youth is different. So for provincial services, it can be 16 to 24. For federal services, it's 14 to 29. For some health services, it's to 18. So just even from an age demographic, it's hard to access some of those services. And then you've got the unavailability of psychiatric care and psychiatrists who are able to diagnose and follow-up support. So what we find is homeless young people are even more marginalized in accessing the services and funding that goes into mental health. So which is why the need for very specific services for this population is so important.
It's interesting, you highlighted how the challenges are integrated, and so must be the solutions as well. Now, when I was doing some research on your organization, I see that you offer a large, suite of programming, and I'm just curious, Mr. Grant, which of your programs has been the most popular as we navigate through this pandemic, and why do you think it is the case?
I'm not sure popular is the right word, but certainly
maybe more utilized would probably be the better.
For sure, it's our mental health supports. We saw, as I mentioned, a 5-fold increase in the number of youth accessing mental health services. So in pre-COVID, we saw the drop-in programs. We were serving over 1,200 youth in our drop-in programs, but that number decreased. And so you could maybe show a correlation between the lack of access to services adding to an increase in the number of mental health services. But to answer your question, it is the mental health services that increased.
Not surprising, Mr. Grant. I know that Tony Van Buyden, MP Van Buyden, has been a big proponent of mental health, and it was the focus of the study for this committee. Just one last question. I'm wondering if you could speak to the committee about the HOPE program, Mr. Grant, and its participation since the onset of the pandemic.
Our HOPE, our anti-human trafficking program.
Yes, correct. Yes.
Yes. That's we are the only housing service for youth in the region, providing human trafficking programs, and it was affected in that it is a small apartment, and so we weren't able to support as many young people. But what we were able to do is actually keep them for longer periods. And one of the challenges, quickly, is just to state that the lockdowns had an adverse impact on many of those youth because it reminded them of being pimped when they were locked into hotels. And so you're trying to balance the health and safety measures, but at the same time, it actually creates trauma.
Thank you, Mr. Kellaway.
Thank you very much.
Monsieur Theriault, c'est à vous.
Mr. Theriault, your turn. 6 minutes. Thank you, Mr. Chair. I want to thank all witnesses for their testimonies. They are to help us understand the collateral effects of the pandemic. I would like to put my question to Dr. Legault. Thank you for your testimony. Just like your colleague, Dr. Perrault, you gave us another surgically precise testimony to make us understand where there are problems. the equivalent of 200,000 people, the equivalent of the city of Sherbrooke on the waiting list. Those are the ones we've identified. We don't even know the patients who have not yet been identified because they have not had access to diagnosis. Some people came to see us from the very beginning of the first wave. They said because of the chronic underfunding, the network was already compromised and overburdened. It's a good thing the government has invested to support the economy and citizens, but must now look at the needs of our health system and allow the provinces and Quebec to have significant recurring funds to enable them improve the network. And this is not funny anymore because you have continued telling us that you're learning from the best practices elsewhere and trying to do more with less. And over the last 10 years, I think you're an expert. And in Quebec, we've developed a certain expertise. We had no choice. Now you're telling us that there's a serious problem now because irrespective how care is managed, it takes people to administer the care. And now we have the direct impact of the pandemic. And this effect is felt on human resources. And we could end up losing expertise that would end up costing us a lot of money to replace. And furthermore, you've talked about operating rooms. This means that even if other people were to be recruited, as was the case with personal support workers, these are experts that we could lose. I would like to hear what you have to say. From the last observations we made, when we did some brainstorming after the first wave, we realized that because of the assault on Quebec hospitals and because of the offloading, that is reassigning staff from the operation rooms in other sections, we also stopped training of nurses and other staff members. Usually it takes 6 to 12 months to train some specialists like respiratory therapists and so on. And if we were to increase the number of competent staff in operating rooms, there's an internet problem with the sound of the speaker. We'll have to split hairs to try to find out what we keep and what we don't keep. So we must continue with training. We stopped training during the second wave because our resources were overdrawn. So, of course, we need to promote the work. It's a very difficult job, but it should be promoted. And you're very right. The resources were already overburdened. The conditions are not optimal, and we've gone through the worst situation we've ever lived through. The interpretation will resume when the sound improves. The sound is very bad.
Donc là, on assiste, disiez-vous, à...
Pardon me, Dr. Legault. We're having trouble with interpretation. Perhaps if you could raise your microphone to maybe mustache level and maybe say a few words to make sure that interpretation is working.
Is this okay like this? Est-ce que ça va bien comme ça? Vous m'entendez?
We are hearing now, but it comes on and off. It's as if there's an internet problem.
Est-ce que c'est mieux comme ça?
It's.
Please continue with your answer, if you would, please.
En fait, j'avais fini la réponse.
I had completed my answer to Mr. Theriou's question, but if I may add, training is very important. And of course, when we talk about training, we need money, and that is very rare now in the public health sector in Quebec. You also indicated that there was career reorientation. So many professionals are being reassigned from operating rooms elsewhere. So to promote the profession, retention is important, and the governments need to know what is necessary and have a certain predictability to be able to carry out those investments. Do you really fear that we may be losing our expertise in the short term? Fingers crossed. I hope that premature discussions on retirement reduce when the COVID situation will improve. If you are a nurse in an operating room and you've been asked 3 times to go to a place where you are not used to working and you have to count the number of dead people, I can understand why a nurse may decide to leave the profession. So the decision to not invest and not do their part, and I'm talking about the federal government, do its part right now to transfer significant funds right away and to wait till after the COVID-19 pandemic. Is that justified? I don't think it's justified. I think more money should be provided now. The profession should be made more attractive right away to reduce reassignments towards other professions. It's not all about money. I think that should be clear. We need to improve the working conditions. Of course, money is part of the solution, in my opinion. Thank you. Thank you, Mr. Therio.
Mr. Davies, 6 minutes, please.
Thank you, Mr. Chair, and thank you to all the witnesses for sharing your expertise and thoughts with us today. Mr. Taylor, you mentioned that the people who suffer the most from food insecurity are Black and Indigenous people, and I think you quoted research that said that Black Canadians are 3.5 times more likely to be food insecure. I'm wondering if you could share where that data comes from, and can you elaborate a little bit more on that point for us?
Certainly, and thank you for the question. So that data comes from research that FoodShare conducted in collaboration with Proof, a research initiative at the University of Toronto that's focused on public policy interventions for food insecurity. So I would say, this research challenged the mainstream understanding of the causes of food insecurity in this country. Previously, when groups looked at aggregate data on food insecurity in Canada, it reveals that things like household composition, immigration status, and access to an income floor for seniors all had impacts on food insecurity. What this research did, it looked at a specific community, the Black community, to better understand what was happening for Black Canadians when it came to access to food. What we found was that, Black Canadians were 3.5 times more likely to be food insecure. We found that 36% of Black children grow up in food insecure households compared to 12% of white children, and also that the percentage of Black homeowners that are food insecure is just about equal to the percentage of white renters in Canada that are food insecure. So ultimately what we found is that whether or not a Black household was new to Canada or here for generations or headed by one parent or two, that the prevalence of food insecurity remained high. So in essence, we found that the typical factors that help protect against food insecurity that we had commonly understood for a long time, like ownership of a home, access to a pension, did not protect Black families in the same way that they do white families.
Now, you also made, I think, a point that I'm hearing made in a number of different scenarios, that COVID didn't create these problems, it exposed these problems. But I'm wondering, has the COVID pandemic, has it exacerbated food insecurity among the populations you serve?
Without a doubt, we just have to look at public transit vehicles and look at who's taking the most risk, or who's been forced to take the most risk. And it's the Black and brown low-wage workers that are out exposing themselves to this pandemic, and of course, then forced to deal with the brunt of its impacts and the disproportionate rates of illness and ultimately death. And we're also seeing that it's our communities, Black communities, that are having less access to the vaccine, less access to testing, and all of those things that we know are essential in our fight against this pandemic.
Now, I read a recent news release from FoodShare Toronto. I think it was about the budget 2021. It said the following, which was, I think it struck me. It said, we know that 65% of Canadians who experience food insecurity have jobs. Everyone has the right to feed themselves and their loved ones with dignity and joy, regardless of their participation in the labor market. But there are people in this country working full-time jobs who are unable to feed their families. And I think you quoted the Living Wage Network that set the living wage for Toronto at a little over $22 per hour. And you conclude that release by saying you want to see federal policies that set income supports and wages at levels that are actually livable for people in our city, meaning Toronto. Having seen the budget come out now, are the federal income supports and wages set at livable levels in that budget, or what was your reaction to the steps that were not taken?
Yeah, I guess, one of the things we've seen pretty consistently with the government is an investment in charitable-based responses. And it might seem weird coming from an organization like FoodShare, but I think to do the work that we do with integrity and authentically is to recognize that charity is not a solution to food insecurity and to poverty. So we absolutely need to look at income-based interventions. And we know that, the government finally moved forward on their plan or their promise to introduce a federal $15 an hour minimum wage. But my goodness, they promised that years ago. $15 minimum wage, is not enough. People are going to be struggling. And I think what the CERB has done is created an opportunity for a wider conversation about how we support people in community. What is it in one of the richest countries in the world? How can we provide the kind of supports that people need, especially those that have been left behind? So I think we need to be talking about livable incomes across the board, and we need to be talking about a basic income in this country. And there was none of that really mentioned in this budget. It was pretty disappointed for us, and I think disappointing for a lot of folks who, again, our systems have made to struggle the most.
You anticipated where I was going. I was going to ask your opinion on whether it's time to implement a guaranteed livable income, or at least begin with some pilots around this country. I think I have your answer on that. I'm going to shift to something else, which is the concept of a universal school food program that was mentioned in Budget 2019. I myself have actually tabled private members' legislation to establish a national nutritious food program in schools. How important is that for us to move on to address food insecurity, at least in children?
Yeah, so I would say, I think the biggest impact that school food programs have are on educational outcomes. And we know educational outcomes are connected to income potential down the road and overall health. So I would say it's an essential type of intervention that we need to be advancing and not neglecting. But connecting it to food insecurity, I wouldn't necessarily do. Food insecurity is largely about income and families not having the income that they need to buy the food that they need. With that said, I think school food programs are essential and will support families that struggle with access to education and to being able to feed their families feed their kids, while at school.
Thank you, Mr. Davies. So, committee, we have a few minutes left. I propose we'll take another shot at a lightning round. So, if everyone's agreed, we'll do 1 minute per party once again, and that'll take us to the end. So, I believe we will start with Ms. Rempel-Garner, please. 1 minute, please.
Thank you, Chair. It's Mr. Canyon. Oftentimes people talk about diversifying Alberta's economy, but the entertainment sector is one part of that has just been decimated by COVID. I'm wondering if you can briefly talk about the broader impacts, not just on performing artists, but also on venues, like audio technicians, et cetera, et cetera.
Yeah, thank you for the question. It's something that we're all in together, no matter if you're an artist or a performer or a tech or a venue. We're all affected equally. If we can't play, the venues can't sustain income or even have any kind of growth. My management, Invictus Entertainment out of Penticton, BC, Jim has told me horrific stories as of late where he's reached out to contacts that he has booked and worked with in the venues for over 20 years who are no longer there, and was told he has to call the mayor of the town or the city to try and access the venue. So one of the biggest concerns coming out, God willing, the other side of COVID is we're looking at 6 to 8 months minimum for these venues to just be restaffed if they haven't been already reallocated. We've lost quite a few theaters across Canada to now becoming movie theaters only, and they're actually taking the time and doing the work under grants to convert the theater. So now we have lost an outlet for all of that 3.1 million people to actually go and earn an income.
Thank you, Ms. Rempel-Garner. We go now to Ms. Sidhu, please. 1 minute, please.
Thank you, Mr. Chair. My first question is to Mr. Grant. Mr. Grant, as you know, this pandemic highlighted the issue of early learning, childcare, and the budget announced last week bring the National Childcare Plan. What long-term benefits do you see for implementing such a system for both parents and for children?
Great question, thank you. And as I noted, prevention is such a critical part of addressing the issue of youth homelessness. So the stronger families are, the less likelihood there will be of down the road homelessness. It's obviously nothing's a guarantee, but it certainly is a big step forward in making sure that families get the support that they need to be able to better understand how to strengthen the needs of their kids, work with the schools, and all of these are preventative measures to address homelessness.
Thank you, Ms. Sadu. Go now to Monsieur Thériault. Monsieur Thériault, allez-y, s'il vous plaît.
Mr. Thériault, you have 1 minute. Yes, Dr. Legault, Dr. Spiro, Bélanger, Champagne, Chabat came here and told us that COVID-19 was going to have an impact on non-COVID patients, particularly on an explosion of cost over the next 10 years. I imagine that you agree with them, that if we do not invest right away, it's going to cost a lot more later. For example, for a polyp screening, it's about 1,000. If the polyp is not discovered now and discovered 2 years later and it turns out to be colon cancer, they cost maybe $20,000. I'm talking about a public system where there's the different types of therapy, jobs will be lost. So the economic cost is absolutely not the same. So it's a savings if we invest now. The social cost, of course, is also there. And this is just a one-day procedure. Thank you. Thank you, Dr. Legault. Thank you, Mr. Thériault.
Mr. Davies, over to you. 1 minute. You have the hammer.
Thanks, Mr. Taylor. What policies do you think should be prioritized by the federal government, particularly using an equity-informed approach?
Thank you for that question. You know, for the folks that we work with, the types of things that we hear are really important. Like I said earlier, people have, they're not receiving adequate incomes. So we need to absolutely prioritize a guaranteed livable income in this country, but we also need to be building housing. When I talk to folks who are accessing charitable food, largely it's because they're spending their bulk of their money on housing. And we know that, you know, I think it was 1993 that the Conservative government got the federal government out of building housing. In 1994, the Liberals kept us out of building housing. So I think we really need to commit to building the type of affordable housing that folks need. And I think also, I also hear horrible stories about people having to split their medicine in half or go without taking the medicine that they need. So I would also say that we need to prioritize ensuring people have access to the medicine that they need. I would be remiss if I didn't add, we need a concerted plan, that a meaningful and concerted comprehensive plan to tackle racism in all of Canada's institutions, systems, and public policies. Until we do that, racism will continue to bestow disproportionate harm on BIPOC communities.
Thank you.
Thank you. Thank you, Mr. Davies. And thank you to all the witnesses for your testimony, for sharing your time with us today and your expertise and your knowledge. And thank you to the members for all of your great questions. And with that, we are adjourned. Thank you all.